and how Medicare relies on member surveys to evaluate provider communication on some of the measures. The topics where we got low ratings is improving or maintaining mental health, monitoring physical activity. Are we actually asking our patients about their physical activity? Are we actually asking our patients about bladder control? Are we actually asking our patients about falling? Those are areas where we're not scoring very highly on the consumer satisfaction survey. Here's the diabetes care and treatment, where we have a bundle of 6 measures for both LDL cholesterol screening and achieving a result in a diabetic population that's less than 100 on the LDL, making sure that they have a retinal eye exam it has to be once every 2 years on the retinal eye exam. Some check of kidney function with a BUN and creatinine, and protein in the urine is also checked, I think, still for that test. The hemoglobin A1C levels, and they need to be on an ACE inhibitor if they have both diabetes and hypertension medications on board. In the osteoporosis management, this is actually looking at women who've had a fracture, and so what the denominator is women with a fracture, and then the way the algorithm runs is we look to see whether or not they have received a bone mineral, a DEXA scan within 6 months, and then let's see, if they've received if they've gotten a DEXA screen or osteoporosis medication. So if they're on a bisphosphonate, we're good. But if they're not on a bisphosphonate, they have to have had a DEXA scan within 6 months of their fracture. And then, and we're not doing, in fact, this is a national problem, but Carl is not doing a satisfactory job in getting DEXA scans on this population, and we're really trying to reach out and improve our results in this space. This is a national problem, but it's a problem for us as well. Let's see here. Reducing readmissions. There's a lot of talk now about reducing readmissions in all areas. The CMS core measures for Medicare Advantage, it's a huge issue. And our top discharge diagnoses where we have the greatest problem is really in the cardiac area, our congestive heart failure population. Almost 30% of our members died during the year-long study of looking at our readmitted population. Remember now, this is the Medicare population, so a lot of these folks are older folks. And when we looked at folks that got readmitted within 30 days, and we looked at that over the course of the year, about, they're our sickest patients, so they're our frequent flyers in the hospital. And so it does raise the question as to how we're approaching end-of-life sorts of conversations. Most of our readmissions occur shortly after they get discharged. So 69% of our readmissions occurred between the day of discharge